am Mary, the public health nurse working within an Indigenous community health center. It is crucial to address the prevalence and impact of diabetes mellitus among them. Diabetes is a significant health concern within Indigenous population, leading to various health complications and disparities. This presentation will explore the incidence, consequences, and dietary patterns leading to diabetes and strategies for effectively managing and preventing it in Indigenous health. Stay tuned for an insightful discussion highlighting the challenges and opportunities in managing diabetes among Indigenous groups. Let's hear from our 4 distinguished representatives who will share more information on this topic. Incidence. I'm going to discuss the incidence of diabetes among the Indigenous population in Canada. The prevalence rates for diabetes according to Diabetes Canada 2024 is 17.2% among First Nation living on reserve, 12.7% among First Nation individuals living off reserve, 4.7% among Inuit people, and 9.9% among Métis people compared to 5% in the general population. I am handing over to Gurkaran, who will discuss the consequences of diabetes mellitus.
Good morning, my name is Gurkaran and I am going to talk about consequences of diabetes among the Indigenous people. Diabetes is a major concern that has rapidly emerged and has a devastating effect on health and well-being of the Indigenous people. It affects them disproportionately with its complications. Indigenous people are at risk of developing diabetes at very young age with high severity and high rate of complications and experiencing poor treatment. So this untreated and improperly managed diabetes can cause extensive damage to kidneys, eyes, circulatory system and peripheral nervous system. And according to Diabetes Canada, the First Nation people diagnosed with the diabetes under the age of 20 are at risk of developing end-stage renal disease with 2.59 times higher and risk of death with 2.64 times higher than the general population. And additionally, Indigenous people are also burdened with various microvascular complications such as chronic kidney diseases, lower limb amputations, and retinopathies. And according to the Alberta's Institute of Health Economics, nearly 25% of Indigenous people has 2 or more diabetes-related complications. And in contrast to the general population, Indigenous humans are also affected by the diabetes. They are at high risk of adverse outcomes with the pregnancy with diabetes, such as macrosomia, low birth weight, cesarean sections, and neonatal traumas. And moreover, the healthcare cost is also 2.3 times higher for the Indigenous people with diabetes in contrast to the general population, and this is due to the increased hospitalization, increased specialized visit for various complications and various treatments such as dialysis. So now I'm going to handle the next 2 Tenzin for next topic. Thanks.
Good morning, my name is Tenzin and I'm going to speak about the dietary pattern leading to higher rates of diabetes among the Canadian Indigenous population. Unhealthy diet and physical inactivity has been identified as a modifiable risk factor leading to incidence of diabetes among Indigenous population in Canada. The Canadian Indigenous population have cultural heritage and traditional food system, and their traditional food system based upon fishing, hunting, and gathering. The foods are rich in fish, fruits, and vegetables, which is low in sugar, nutrient-based, and good in high-quality fat, which helps to prevent the occurrence of diabetes among them. The energy spent on hunting was significant as there was a physical demand which kept them fit and active for a long time. However, after colonization, loss of their culture, intergenerational trauma, food insecurity, social isolation, low socioeconomic status, and introduction of processed and canned foods such as like this has caused higher rates of diabetes among Indigenous population of Canada. And the children of the Indigenous population consume more snacks than fruits, vegetable, and milk. This also has caused major health issues among children. So this negative impact on the lives of Indigenous has caused higher rate of diabetes among them. And now I would like to hand over to Ravneet to continue with health promotion strategies.
Hi, this is Ravneet Kaur, and today I'm going to speak about the different health promotional strategies which are used in order to promote health in indigenous population for diabetic mellitus. So these strategies are given by the ADI. ADI stands for Aboriginal Diabetic Initiatives, which is created in the year of 1999, and the main focus of these initiatives is to promote health not only the individuals, also for their family and community. So the first strategy is cultural awareness and sensitivity, which involve understanding, respecting and valuing the custom, practices and perspective of the indigenous community. Second is the community engagement, which focus on the active involvement of the community people in the plan of care. It also consists of the workshops which are led by the healthcare professionals from the same community. Third one is the access to the healthcare services, which consist of the telemedicine and the mobile services based on the diabetic food care. That could be a good example. And the fourth strategy is food insecurity and nutrition. We have to keep in mind their traditional food customs and then planning their diet according to their body requirements and their availability of the food to them. Fifth one is the physical activity promotion, which can include the promotion of the physical activities, which are we can promote their traditional dance or traditional games. And the example of the traditional games are canoeing, and the second one is the lacrosse. These are the two main activities which can be a good example to promote their health. Last but not the least strategy, which is the holistic approach to healthcare, which include holistic wellness techniques and the traditional healing activities. At last, I would like to recommend the government has to focus more upon the early detection and screening of the disease in the indigenous community, and they have to provide education and awareness, keeping in mind their cultural practices, their cultural priorities and their needs. Thank you.
Good afternoon, everyone. My name is Nicolas Munoz Rojas, and today I'm going to talk to you about diabetes mellitus in the indigenous communities of Colombia. This is a phenomenon of growing concern that reflects not only global health dynamics, but also the unique cultural and socioeconomic complexities of these populations. Although I lack precise data regarding specific percentages, I can provide you with a detailed description of key aspects related to incidence, consequences, dietary patterns, and health promotion strategies in this context. The incidence of diabetes mellitus in indigenous communities in Colombia has experienced a steady increase in recent decades. This increase can be attributed to several factors, including changes in traditional lifestyles, the introduction of Western diets, urbanizations, and genetics. Disparities in healthcare and lack of access to quality health services also contribute to the prevalence of the disease in these communities. Type 2 diabetes mellitus affects 12% of the Colombian indigenous population, a figure 2 to 3 times higher than that of mestizos. Prevalence varies between groups. In Berachami, 14.5%, Wayuu 12.8%, Nasa 10.6%, and Cancuamo 8.2%. Indigenous women are at higher risk than men. Incidence increases with age, especially after 4 years of age. The consequences of diabetes in indigenous communities are multiple and affect overall health. Chronic complications include cardiovascular disease, kidney damage, neuropathies, visual problems, and, in severe cases, amputations. Barriers to accessing adequate health services can exacerbate these consequences, as early diagnosis and management are essential to prevent long-term complications. Regarding mortality, diabetes mellitus 2 is the second leading cause of death among indigenous Colombians. Likewise, the following complications occur: cardiovascular, myocardial infarction, stroke, renal chronic kidney disease, and renal failure, neuropathy, nerve damage, numbness, pain, retinopathy, damage to the retina, blindness. Likewise, increased risk of infections and tuberculosis. The traditional dietary patterns of indigenous communities in Colombia, based on local foods and ancestral practices, have been affected by the influence of the Western diet. The introduction of processed foods rich in saturated fats and sugars has contributed to the increase in diabetes. The loss of healthy and sustainable dietary practices has played an important role in the transitions to a less healthy diet. Increased consumption of traditional foods, fruits, vegetables, fish, decreased consumption of processed foods, sugar, saturated fats, refined carbohydrates. Also, with regard to food insecurity, difficulty in accessing nutritious and fresh food, dependence on processed and low-cost foods. Undoubtedly, addressing diabetes in indigenous communities requires specific strategies that respect and value cultural diversity. Interventions should include culturally appropriate education programs that respect traditional health beliefs and knowledge, addressing myths and realities about diabetes, promotion of healthy lifestyles, encourage the preservation of healthy traditional dietary practices, and regular physical activity adapted to the cultural realities of these communities. Improving access to health care, ensuring the accessibility of quality health services, particularly in rural areas, can be key to the early diagnosis and effective management of diabetes. It is critical that these strategies are designed and implemented in collaboration with community leaders and respecting the cultural autonomy of indigenous communities. The approach should be comprehensive, addressing not only the medical aspects but also the social and cultural factors that contribute to the health and well-being of this population. Next, it is essential to take into account an intercultural approach, promoting and considering the following tools for Colombian indigenous communities. Respect indigenous cosmovision and cultural practices, involve communities in the design and implementation of strategies, promote the consumption of traditional and nutritious foods, teach how to prepare healthy meals with local ingredients, encourage regular and culturally appropriate physical activity, access to health services, improve access to screening, diagnosis, and treatment of type 2 diabetes mellitus, train health professionals in the care of diabetes in the indigenous population. Finally, as recommendations, it is essential to strengthen research on diabetes mellitus 2 in indigenous communities, develop public policies for the prevention and control of diabetes mellitus 2 in the indigenous population, and finally, implement health promotion and diabetes mellitus 2 prevention programs with an intercultural approach. Thank you so much.
Thank you to our insightful representatives for sharing their expertise on diabetes mellitus in indigenous population. Raising awareness and taking proactive steps towards better health can make a significant differences. Stay informed, stay healthy. This is Mary signing off. Have a fantastic day ahead.